You may be a candidate for labiaplasty if you have enlarged labia minora. Some of the problems that enlarged labia minora can cause are chafing, or when the skin rubs together, it can cause skin breakdown. You can also get yeast infections from that redundant skin being on top of each other. It can also lead to some uncomfortable problems during intimacy and during even just normal everyday activities like walking around or exercising. It can sometimes be visible, especially in tight clothing or in bikinis. So if you do feel like your labia are enlarged and you would like to come in for a consultation, right now is a great time to do the procedure, and we can get you back on your feet very, very soon. So what is a labiaplasty? A labiaplasty is a reduction of the labia minora, and it involves making a skin incision through that extra redundant skin and removing it and placing sutures or stitches on the inside and on the outside in order to put the skin back together again. It gives a nice natural appearance afterwards, and it removes the majority of that redundant skin so that it doesn't lead to those problems that we discussed earlier, like infections and chafing and visibility in clothing. The procedure can be done under both local anesthesia and general anesthesia. So depending on the patient's preference, to be either completely asleep for it or to be awake, I can do the procedure either.